you beautiful people. My name is Cho and I am your host for Parentology, a show by a parent for all the parents out there. Parenting is one of the most exciting responsibilities you will ever take on. It doesn't come with a manual, and you will have a very difficult time initially figuring out how to be a good parent. But trust me, you will figure it out, just like I did. Correction, just like I'm still figuring out. Here's a recap of what we talked about last week. Pica is the practice of craving substances with little or no nutritional value.
Actually, it's a sign that a mother is anemic, that means low blood in her body. We advise them to have iron-rich food, especially where our daily diet does not contain that much iron, which is sufficient for the baby and the mother. So we give them iron supplements.
Food aversions are caused by hormonal changes in the body that occur during pregnancy. Increase your daily intake of folic acid, one of the B vitamins, to at least 400 micrograms to help support proper development of your baby's spinal column should you become pregnant. Today, we will look at a couple of things. 1. What to pack in your hospital bag. 2. What goes in your diaper bag. And 3. Finally, we'll listen to some tips and advice from experienced parents. Let's go ahead and check what goes in your hospital bag. So you have finally completed your 9 months of pregnancy and now you're ready to deliver your precious little one. Unlike what they show in the movies, you will have time to collect all that you need and all that you need to go to the hospital. Trust me, there are only very few cases where you have to literally be rushed to the hospital. No matter how you end up going to the hospital to deliver your precious little one, it'll only help to have your bags packed and ready to go. I remember I packed my hospital bag and diaper bag when I was 8 months pregnant, and that I thought was a pretty good time to do that. You don't want to wait until the 40th week, which is the full term, because some babies might want to come early. Therefore, pack your hospital bag and your diaper bag at least a month ahead of your due date. A lot of you must already know what a hospital bag is. It is the bag in which you put all the things you will take to the hospital to deliver your baby. Now, in the mother and child book that you get when you register as an expectant mom, there is a list provided there too. You're required to bring 2 packets of perineal pads, 1 soap, 1 plastic sheet, 2 bed sheets, 2 underwears, 2 petticoats, 1 change of clothing. And for the baby, 1 clean towel, 2 blankets, and 10 nappies. If you just show up at the hospital with just those things in the book, you will be taking the bare minimum. Therefore, after asking around and drawing from my personal experience, I have made a list of things to put in your hospital bag. Number 1, change of clothes for the mom. Make sure she has tops that would allow her to easily breastfeed. Nursing bras, spaghetti straps, and petticoats, like mentioned in the book, are a must, along with 2 to 3 changes of underwear. Now, you don't necessarily have to bring your granny panties, but make sure it is not too tight or too loose. Remember, you want to be wearing only comfortable clothes. Keeping in mind the traditional method of caring for the new mom, you might also want to bring in something to cover her head. Perhaps a cloth nappy or even a hat. Also make sure the mother has a warm jacket and 1 to 2 pairs of cozy socks, as it's crucial in our culture to keep the new mom warm and snug. Number 2, bedding. I would recommend you bring 2 bed sheets. You might only use one, but there are times when you might have your water break on the bed, or you might accidentally bleed on it. So it is always wise to have 2 sheets. And it's also always better to have clean sheets when you have a new baby on it. You will also need a pillow or more and a blanket too. Oh, and don't forget your towel. Number 3, sanitary pads. You do not necessarily need to have those big maternity pads. The maxi pads that you can get from any store around would work too. Number 4, eye mask and earplugs. Hospitals, especially the maternity wards, are usually awake most of the time. And regardless of what time it is, there will always be someone in labor, in pain, or newborns crying, and people talking to each other. Therefore, I recommend you take something to cover your eyes and earplugs to block away all the noise, unless you're the one making it. You have to be patient and understanding to everybody around you, but you also need to get your rest. Number 5, slip-on slippers. Do not take slippers with straps or buckles on them. Trust me, you want to have a pair of slippers that will easily be put. Also, if you have a choice, take slippers that has good grip and wouldn't slip. Number 6, snacks and drinks. Labor pains are very unpredictable, so make sure you take your favorite snacks and lots to drink, because you never know how long you'll be in the hospital for. Number 7, mobile phones and the charger. Us Bhutanese, we love our mobile phones. While some of us use it to update our family and relatives, there are others who use the phone to document their whole experience of labor and birth, like I did. So you want to take your phone with the charger and maybe even a backup charger. Number 8, toiletries, which includes both you and your partner's toothbrush, face wash, face cream, soap, toothpaste and hairbrush, and any other products you would use on a daily basis. And if you could bring a hand sanitizer too, that's great. Number 9, breast pumps. As a new mom, you will face various challenges during breastfeeding, ranging from no milk production to flat nipples. During those times, a breast pump comes in handy. It also provides the stimulation needed to produce milk. So make sure you bring a sterilized breast pump with you to the hospital. And now we have the baby bag, or popularly known as the diaper bag. This is the bag that will have all the necessary stuff for your precious newborn. Number 1, 10 to 15 cotton nappies. These are a must for any Bhutanese baby. Unlike other babies born in the West, we love to swaddle our newborns from head to toe in these cloth napkins. You could use it as diapers, as a swaddle, as a wrap, and to cover the head of the baby too. You could get colorful ones, plain ones, big ones, and small ones. And they're very affordable, ranging from Nutrim 30 to 40 per piece. I like to use the colorful ones to wrap and swaddle the baby, and the pure white ones as their nappies, diapers. Yes, you will need a lot of nappies, but for the hospital, 15 should suffice. And make sure you have washed all the cloth diapers once before you use them. Number 2, 2 baby blankets or baby sleep suits. Once your baby is neatly wrapped in a couple of nappies, you will need something thicker and warmer to keep your baby warm. It could be a baby blanket or one of those thick swaddles or a sleep sack. When buying a sleep sack or suit, refrain from buying those with sleeves. Trust me, those sleeves are useless because your baby is too tiny to have their hands in them. Number 3, hats and mittens. Whether your baby has a lot of hair or not, she will need a snug cap and a pair of mittens. Make sure you take caps of different sizes because you don't know how big your baby's head will be. I remember I took only 2 caps for my baby and my baby's head was pretty big and both those caps didn't fit her. So, which is why I ended up using the cloth napkin to wrap her head. And mittens come in handy as your baby could have long fingernails that could scratch her. Number 4, newborn diapers. This is one of those things that you really might not need. Traditionally, babies don't wear those plastic diapers, and this is why even now some of us are skeptical about using factory manufactured diapers on our newborns. But if you're one of those who love ready-made diapers, make sure you take a whole new pack with you to the hospital. Number 5, cottons or wet wipes. The first few baby poops are the toughest to clean up, which is why you will need wet wipes, or you could use cottons to clean them up. Refrain yourself from buying scented napkins because it could irritate the baby's skin. These are the basic necessities for your baby's first few days in the hospital. Some like to take few things more, like a baby's outfit, some baby lotion or creams. You could definitely do that, but remember to keep your bag small and light. The hospital wouldn't have a lot of room for your big bags. Now that we're done with diaper bags and hospital bags, here are some tips for all the mothers who will spend their first few days in the hospital with their newborn. Number 1, keep yourself fed and hydrated. Once you get your labor pain, you won't be allowed to eat or drink. Therefore, you want to eat and drink as much as you can to gear up for the whole painful, exhausting experience of becoming a mommy. And also, you need the strength. Number 2, keep moving. This is in reference to those women who have started their labor pain. Staying upright and moving around can help your labor to progress as it helps with the dilation and also helps move the baby's head to the pelvis. But be careful not to wear yourself out from all the walking. Now, this can also be applied to women after delivery or a cesarean. You want to move without hurting yourself or exhausting yourself. If you lay in your bed for too long, healing gets delayed. This is why walking after the day of your C-section or vaginal birth is crucial. Number 3, do not be alarmed of the thick, waxy substance called vernix covering your baby's skin. This substance protects the fetus skin from the amniotic fluid in the womb. Vernix should wash off during the baby's first bath. Number 4, be mindful of the cord and the cord clip whenever you're dressing or undressing the newborn. Number 5, do not use any powder on your newborn. It will make your baby's skin dry. Number 6, do not use scented products on your baby. Scent can irritate and agitate your baby's skin. As long as baby products go, always and always get it free of fragrance. Now, here are some tips from the experienced mothers on Instagram. 1, carry a portable fan. You will need it, especially during your labor. 2, bring good deal of underpants. Buy some comfortable baby clothes in advance. Start and continue breastfeeding despite the soreness and lack of milk. It comes in few days. Drill a hole in a mineral water bottle cap and use it to clean your private areas after toilet use. You will be too sore to use wipes or clean your bottom. Extra clothes for yourself. All we think of is our baby that time, and we forget about ourselves. Nice rest pillow. Take it easy. A tiny human being just came out of you. It will hurt. It will get better too. You may experience postpartum depression. It is normal, but it is also good to talk about it. Your body may not feel the same as it did before you had a baby, but look at you now. You're beautiful. You have given life to a body. Nothing is more amazing or beautiful than that. So take it easy, eat what you will, take care of your baby, but also take care of yourself. This is also very important. Enjoy motherhood. Take these things just in case. Baby spoon, cup and bowl, and flask filled with hot water. If you deliver through C-section, constipation is normal. However, be sure to inform the nurses so that they can give you some medicine to help you relieve your bowel movement. Being a new mom is lonely. There is some truth to it. You're faced with a completely new lifestyle, and everybody around you is telling you what is right and what's wrong. And sometimes, even though their intentions are right, they end up hurting you and confusing you. I know it's difficult because I went through it too. And I know how helpless and tiring it is to be a new mom. And this is why we have this show, hoping that it'll help you realize that you're not alone and that we are all mothers and we're here for each other. On that note, I will take leave. For suggestions and feedback, please email me at choni@bbs.bt or Instagram me at chozok, or leave me a comment on the YouTube channel BBS channel 2. Lok shule jage. Until then, support each other and be positive. Bye bye.